Hello.
Yes, we can see your screen. Carry on.
Okay, thank you. So good afternoon, colleagues, once again. I'll take you through the epidemiological situation as of January 19th, 2020. So for the global update, you can see that so far we've recorded 94.1 million confirmed cases um, globally, and over 2 million deaths, and it has resulted to 2.2% case fatality rate. And so far, Americas and the Europeans are reporting the highest number of cases. So this slide illustrates the epidemiological situation of COVID-19 in Africa as on this day, 20th January 2021. And the epic curve is showing the new COVID-19 cases reported daily by regions. The red lines represent the 7 days moving average that indicates the continuous reported cases in 55 member states. And the Africa figure shows over 3.3 million cases and over 80,000 deaths, resulting to 2.4% case fatality rate. And then so far, over 2.7 million has recovered. 83% people have recovered from COVID-19 across the continent. However, the cases reported are still on an upward trend, but it is declining a bit. So I wouldn't say we should celebrate now, but it is still on an upward trend. Okay, so this is the map of Africa that shows the categories of member states reporting COVID-19. On the left side are the categories. We can see 18 countries reporting less than 5,000 cases. 7 countries over 5,000, within 5,000 and 10,000 cases, and 19 countries over 10,000 to 50,000 cases, and 9 countries over 50,000 to 500,000 cases. Only one country, 500,000, which is reporting over 500,000 cases, is South Africa from our region. Okay, so moving on to the table. This table is shown of COVID-19 new cases, deaths, and recoveries. And the new cases in the last 24 hours is over 200,000, and then deaths over 6,000, and the recoveries over 200,000. And so far, most of the cases are being reported at the southern region, and it is recording the highest number of case fatality rate, followed by the northern region. So here, this is the new COVID-19 cases reported per 1 million population per day by AU member states. You can see 38 countries, less than 40 cases per 1 million per day, and 4 countries over 40 to 80,000 cases per 1 million, and then 1 country over 80 to 100 cases per 1 million, and 7 countries over 100 cases per 1 million. Here shows the case fatality rates by AU member states. You can see that most of all the member states in the southern regions are in the green and the red category, which is reporting less than 2%, and member states reporting within 2.4% and to 5%. So with regards to testing, this graph illustrates the cumulative testing conducted in all AU member states by region. Over 29.4 million tests has been conducted, and 8.9 tests per reported cases, and 11.3% positivity rate. But the percentage change from last week to this week is by 4% thereabout. I think that is the last slide from here. Over to you, Izine, and thank you for listening. And I'm available if you have any questions. Thank you.
Thanks a lot, Chika. So any questions on the
presentation from Chika. Any question at all? Okay, in the absence of that, we'll move quickly to the main agenda for today, which is on other diseases, events reported by member states, a continental overview, and I'll hand over to Yaya to take us through this. Over to you, Yaya.
Thank you very much, Ezene. Today's presentation is very much important for the fact that we have realized that over the past 1 year, sorry, COVID reports has overshadowed all other events that are happening within the member states. And Africa CDC is not only concerned about COVID, but we are as well also concerned with all other disease events that also have the potentiality to constitute an outbreak. So it's a very short presentation based on the diseases that we have been capturing that we have captured for the past 1 week, based on our EBS report, which we normally issued every Friday. Currently, is an internal document. We don't started sharing it with our member states, but you can find them in our website, the Africa CDC website. So the objective of this presentation is to encourage the Southern Africa member states to be able to share their other disease reports with the RCC, and also to help you in terms of how to seek support from Africa CDC regarding the other diseases apart from COVID, and also how we can support in the continuation of essential services amid rising cases in the region. So this is a continental overview. These are the presentation format. I'll start with the high risk events which have been reported by Africa CDC. That's polio, which is of course vaccine drive in Africa, dengue fever in Ethiopia, yellow fever in Nigeria. Then the moderate events that we are reporting have measles around Africa, and also an anthrax which has been reported in Ethiopia. It's an animal event. So for the polio vaccine, polio, which is of course a vaccine drive, an update to the event. So since the beginning of this year, the continent has reported a total of 524 cases, and no deaths has been reported so far, and this has been reported in 19 countries. So for the Southern Africa countries that we have the data, you can see we have Angola, and okay, so it's only Angola that reported polio for the last 1 week. Okay, we have 524 confirmed cases with 0 death, with 0 case fatality, and 19 AU member states are reporting this event. Some of the response activities that are ongoing: South Sudan Ministry of Health has launched a vaccination campaign against polio from the 10th to the 15th of January 2021, and they are targeting 34,556 children under 5 years of age in AJK district. For dengue in Ethiopia, so far they have reported 9 confirmed cases, with 4,394 suspected cases, and 0 deaths reported. And this dengue has been reported in the Derdawa and the Somali regions of Ethiopia. This was first reported by Africa CDC on the 24th 25th of August by the Ethiopian Public Health Institute. The response activity that is ongoing currently, Africa CDC is following up the event closely with support from the Eastern RCC and also Africa CDC's focal point in Ethiopia. For yellow fever in Nigeria, so far since the beginning of the outbreak, 145 confirmed cases has been reported, 3,426 suspected cases, and 262 deaths, bringing it to a case fatality rate of 7.3%. And this was first reported on on 4th November in 16 states in all the 16 states in Nigeria by the Nigeria Center for Disease Control. Some of the response activities that are ongoing there, the Nigeria CDC is coordinating response activities through the National Yellow Fever Emergency Operations Center, and also in collaboration with local state governments and partners, preventive mass vaccinations campaigns have been concluded in some of the states. And Africa CDC is monitoring the situation and providing regular updates to its EOC. For measles in Africa, so far since the beginning of the outbreak, we have 14,922 confirmed cases, 154,972 suspected cases, with 1,430 deaths reported so far, constituting a case fatality rate of 0.9%. Since the beginning of this year, the continent has reported the above cases and deaths from 12 countries. Cameroon, these 12 countries includes Cameroon, Central African Republic, Chad, DRC, Ethiopia, Kenya, Mozambique, Niger, Nigeria, Somalia, South Sudan, and Uganda. Africa CDC, through its regional collaborating centers, is monitoring these events and providing regular updates to the EOCs. This is an animal event which was reported in Ethiopia, and anthrax which was reported in domestic cattle from the Amhara region. Since the beginning of the outbreak, 199 confirmed cases with 1 death, and this has been reported in 5 regions in Ethiopia. This was first brought to our attention since in 25th of June on 2020. Some of the response activities, Africa CDC EBS, that's the event-based surveillance team, has reached out to the Africa Union Inter-Africa Bureau of Animal Resources for response measures to be taken. This was an event that I picked during the Malawi EOC meeting because we realized some of the reports that have been sent by our volunteers, most of the events apart from COVID are not captured. So that's why we definitely want to do this today, so as we can encourage our volunteers to help us report into some of the events that they captured during surveillance. So this was captured during the Malawi EOC meeting. It was an outbreak of typhoid fever in one of their regions. And we all know typhoid fever is caused by the bacterium Salmonella typhi, and it is an important global public health problem. Typhoid is normally endemic in countries where there is inadequate safe water supply and inadequate sanitation. Water samples were collected from some of the water sources of the affected villages. So that's how they were able to confirm it was a typhoid fever outbreak. And this was first reported in November 2020, and the cases peaked by late December and early January, according to the report. Currently, they are distributing chlorine to households for drinking water treatment. Community awareness campaign is ongoing for typhoid. And also there are active case findings in the affected villages. This is just a region and it's only very few villages that are affected. They are also doing case management for those patients who are already confirmed. Okay, so as I mentioned earlier, it's a short presentation. I thank you all for your kind attention. So if you have any question, the floor is open. Over to you, Ezine.
Thank you very much, Yaya, for the very quick presentation. We've had more people join us. Okay, so now it's time for discussions and feedback, because whether COVID is there or COVID isn't there, these other outbreaks are still going to go on, and we've realized that we're going to be with COVID for a while. So we have to actually start keeping track of these other outbreaks that have been going on. And like my colleague said, the reason why we brought this to our notice is that this is an information sharing platform where we get information from member states share information with each other. We also share information to member states. And we have given you a picture of the events we've been tracking. And as my colleague also mentioned, we're keen to get information, to start receiving information on outbreaks from member states. And I don't know if he mentioned that we have this weekly EBS newsletter that we produce, and the information comes from member states. We've started joining member states EOC meetings or IMS meetings so that we can get first-hand information on these other outbreaks as well as COVID. And another way we can get this information is by you sharing with us via the various platforms, through the WhatsApp group, via email. Almost everyone here has received an email from us at some point. You can share your CTREPs or information on figures and other things with us. But importantly, we want to have at least one contact from surveillance from each member state, so that we know that this is someone we can reach out to, and you also know that this person in this country can reach out to us. There are some people we have, but this isn't official, and it's from time to time the people stop giving us information. So that's why we said it was important to have surveillance teams join the call today, people from surveillance teams join the call today, so that we can have this discussion, and maybe each member state here can give us one person or guide us on how we can go about getting official information from your country. So yeah, I hope I'm still on point with your intent.
Yeah, so definitely you are.
Okay, so great. So this is time for discussion, feedback, questions. So I don't know if anyone has anything to contribute. There's someone called EOC Data. I don't know which country that is from. We have South Africa, Nevashan joining us on the call today, who actually works in surveillance, which is great. And EOC Data Omaruru. I don't know what country that is. So I'm still waiting for feedback on how best you think we can do this collaboration. It's up to you. We can't impose. It has to be an agreement between us, Africa CDC, and you as the member states here present. How best can we get this information on other outbreaks? Information on COVID is out there. Countries are sharing it on their handles.
and all that. It's definitely has overshadowed other things. So these other outbreaks, how can we get information from your country? That's what we want to discuss today or at this point. We need suggestions from countries. Yes, Devashan, your hand is up.
Hi, everyone. So, for South Africa, so I can speak on behalf of what we have here at the National Institute for Communicable Diseases. I actually think that the best possible route to get that information, yes, from through the NICD would be through the notifiable medical condition surveillance. There's a new head of that surveillance system, and I'll pass on his details. And I think contact with him would be very beneficial. And then obviously with myself through the EOC, should we be alerted to anything, we'd obviously make everybody aware. And then through the National Department of Health, I think the relevant people you are aware of, but it does take everybody to share information for this to work, and just really identifying the relevant people. So from our side, I think that would be the three avenues for you to get outbreak information. At least one person from NDOH, or the focal point, definitely, or somebody from the focal point's office, the National Notifiable Medical Conditions Manager, and then us as ourselves from the Outbreak Response Unit or EOC. Thank you.
Thank you, South Africa, for kicking this off. I think that's how we're going to go country by country. Even if you're not the person, you can tell us how we can reach out to your country. South Africa has given us 3 avenues through NICD, EOC, and the Ministry of Health. So we really appreciate that contact from NICD. We have initiated contact with the EOC in South Africa, and we're waiting for feedback to be able to be part of those meetings. So written to Dr. Clelier. And we have a contact person from Ministry of Health. But if you have someone in Surveillance Ministry of Health, also please never share the contact with us in the chat function. So which country wants to go next? Can the host country say something? We have people from Zambia. Yeah, so Mr. Sakubita, would you want to share with us how best we can capture this data on other outbreaks aside COVID from Zambia? We have Mr. Sakubita, who I know works with the surveillance unit.
Yeah. Yes. So, yeah, I may have been. Sorry, someone was calling. I may have missed a bit of what was said in the introductory comments, but what I'd like to say regarding capturing other outbreaks of equally high importance, we probably need to strengthen the IDSR. That's the implementation of the 3rd edition. Like we have started the rollout in the country. So our goal is to try our best to ensure that that system is working, because that way we'll be able to capture any other outbreaks that may be occurring within our our districts, so that we do not miss any of the outbreaks, since there's already a standardized system of reporting on a weekly basis. And the districts know that each time they face a new, excuse me, each time they face a new occurrence, like we had, for instance, a few measles cases that we reported last year, it's easier to capture that information through the routine surveillance system, since we all seem to be busy with the response to the COVID outbreak. So one of the things we're doing at the moment, we are rolling out IDSR as a country trained in 9 provinces. and we were targeting people at district level so that they can also help us train health facility staff. We know that once they're trained in surveillance, they'll be able to detect any sort of outbreaks or diseases that are occurring through their districts, including communicable diseases that including rather communicable and non-communicable diseases that we have been monitoring.
Okay, thank you,
So,
Mr. Sakubita.
for
Okay,
now, I
sorry.
think that would be my submission.
Oh, okay. So the discussion today, thank you so much for the information. So we're trying to be a bit more proactive today. We had done a presentation on other outbreaks on the continent, and we are trying to see how we can get information on these other outbreaks if they are ongoing in your country. So like South Africa has just mentioned, these are the contacts we can reach out to. So what we had wanted to hear from Zambia is, can we reach out to you, Mr. Sakubita, who is on the call, or is there someone who has been designated that we can reach out to who can share information, C-trips, on other outbreaks? Should there be an anthrax outbreak in Zambia? Should there be the vaccine-derived polio in Zambia? Who can we reach out to get more information on this in Zambia, Mr. Sakubita?
Okay, get your point. So, yeah, I don't know whether we may need to designate specific people to provide that particular information, because like the system I was referring to, we expect that if we have any outbreak, the provincial surveillance officers in each of the 10 provinces in the country should be able to communicate. So today I was just following up on one of the reports with one of the provinces. So maybe, I don't know what Dr. Kapinga may have submitted, but for the purposes of strengthening the already existing integrated disease surveillance and response system, my submission would be that we have the contact persons are already there, who are the provincial surveillance officers. And it's one of their mandates to ensure that they report any particular outbreak that may occur. So for now, if you allow me, I would be very comfortable if we could share the contacts of those 10 provincial surveillance officers, who of course will liaise with the provincial directors in case there's any public health event that is worth reporting, which we need to share through the platform as well as
Okay, so Mrs. Sakabita, we can reach out to you. Can someone from Africa CDC reach out to you if you want to confirm any outbreaks? Are you allowed to share the data?
Yes, that is okay with me. Yeah.
Okay, so
Since we're in
great.
surveillance, we'll be able to share, yes.
Awesome, so great. So now we
At
have,
national level, yes.
awesome. So we have heard from South Africa and we've heard from Zambia. So Namibia had written something in the chat, says Namibia COVID-19 C-trips are available on WHO country websites. Alternatively, we can email C-trips to focal person. Okay, so thank you very much, Namibia, for this information on COVID-19. So how about other outbreaks that are ongoing or could be ongoing in Namibia? Who can we reach out to? Miss Yalo, you can make comments. Who can we reach out to give us this information?
Yes, good afternoon, everybody. Yes, you can reach out to our office. We are having dedicated surveillance officers who are producing reports and submitting reports to the relevant bodies when it comes to the outbreaks. So from our side, it may be just to go into talks and strengthen the submission as we are sharing it to WHO and other entities. We also share it to the focal persons. Otherwise, the system of reporting the outbreaks or notification of outbreak is in line with the IDSR guideline, which is currently under review. Thank you.
Okay, thank you very much. Someone wanted to say something before?
Yeah, that's me.
Okay.
Okay. Okay, thank you very much for your submissions, Patrick Sakwita, Neverson, and yellow. Normally, the EBS system for Africa CDC, we do media scanning, and once we come across an event, then we contact our various focal points in the member states where this event is reported, just to verify what has been reported is true or not. So for the measles and polio, we normally pull that report from the WHO website, which they normally the member state used to share with them. But for other disease conditions, we know that the IDSR that the member state use most of the time is passive surveillance, which are only issued on a monthly basis. But there are outbreaks along the way. So the suggestion that I can make, I think, is our rapid responders if they can be able to support us on this. Whereas if they are submitting their weekly reports, if there is any other disease that is reported within that week, they can also report it along to their individual reports or on the consolidated report that sent us to make it more easier. But in terms of verification, when we come across an event in the media, we have our various focal points in all the member states that we normally consult for that. But we believe that for the Southern Africa RCC, we have not been doing very much lately, because currently the only report that we are getting for other disease is measles and cholera, which is being reported in Mozambique. But for other member states, apart from the reports that we get from WHO on measles and polio, for other diseases has been very passive. So this is what we want to be very much active, where we can, while we are in the field, we can be looking for other conditions. And once we realize that this is something that we're reporting, so it can be included in the reports that our rapid responders has been sending to us on a weekly basis. Over, Ezine.
Thanks, Yaya. So that's another avenue we can explore. We have rapid responders in Malawi, Zimbabwe, Zambia, and Namibia. So we are saying if it's possible that those rapid responders, and for Namibia, their coordinator is here, Ialo. So if they can also add that to their reports, so that's also another way of collecting that information, in addition to reaching out to surveillance officers in the country. So, but for these other countries where we don't have rapid responders yet, at least we've gotten some information from South Africa on how we can verify these anything we get from the media scanning. So any other contribution? We've heard from Namibia, Zambia, and South Africa. We still have Zimbabwe and Malawi on the line. Or even anybody else from these other countries who has anything else to add.
Hi, Ezine. For Zimbabwe, there is a weekly surveillance report which encompasses all the other diseases, and the point person to get in touch with would be Dr. Portia Manangazira. She's the head of the surveillance unit.
Thank you for the information. And she also happens to be coordinating the rapid responders, so that's quite great. Okay. So anybody from Malawi to say anything? Or from any other country? It's so quiet. Okay, so
Hello?
yes, Mr. Kateli.
Yeah, this is Katele Ernest from Zambia.
Okay.
It's a request to say anything. Thank you for that. Yeah, I think I would like to echo on what my colleague Patrick mentioned regarding the reporting system of any other condition that is of public health concern in Zambia. So we have already a system in place. And it's coordinated by the national head of epidemic intelligence and disease um, uh, control unit at ZNPHI. So basically there are some subdivision units that are actually working under surveillance and so on and so forth. So first to mention that I think what we need to strengthen in terms of detection and early warning systems is to initiate an evaluation process that will enable us to monitor whether the event-based surveillance at local level is working, because I think that's the key to help us detect these diseases timely. If not, then we'll have a situation of reporting the condition that have already occurred and the harm has been already, propelled in the community. So I think from my point of view, let's not forget, in as much that we are trying to strengthen these processes, let's remember that the event-based surveillance system at a local level, and we're talking about at community level, being realized and being effected in our member states, because I think this is the key to early detection, early response, and early, interventions. So I think that's my submission for now. Thank you.
Okay, thank you very much, Dr. Kateli. So it might be helpful if you can put your email in the chat function for anybody that wants to reach out to you with respect to events-based surveillance. And you can also follow up with Nevashan for the contacts he said he will share with us for South Africa. So if there isn't any more contributions on this, we can actually close discussions around this for today and move on to the next agenda item. Nobody? Okay, so thank you very much for your feedback, and we'll follow up on the different next points. For AOB, before we wrap up, just to mention that we are proposing that for the next ECHO session, we discuss vaccines, what Africa CDC's stand is, strategy, as well as we also want to hear from the countries in the region, how far you've gone with respect to COVID-19 vaccines, what plans you have in place in country, and if you've settled on a vaccine, how, and what it says you've settled on. So we'll start active sensitization to make sure that we have a full house come next 2 weeks. And so you hear from Africa CDC, and Africa CDC will also like to hear from you. So I think we have reached out before for EPI managers, but also we'll follow up to make sure that the invitation for the next ECHO session gets to them. I think this is a discussion that everyone will be excited to have, because that's what's the next chapter with COVID-19. To wrap up for today, I'll hand over to the regional coordinator, Dr. Lul, to give us closing remarks, and we can close early for the first time in about a month. Over to you, Dr. Lul. Dr. Lul?
Yes, good afternoon. Good afternoon, colleagues, and thank you, Esni, and thank you, colleague, for the presentation. First, I would like to emphasize some of the points that was brought up by colleagues. I see most of you are from surveillance, and you truly understand the importance of surveillance. The surveillance is being done to collect the information. The overall goal is to provide good quality healthcare to the people, give us timely respond to any outbreak or to any health issues that is going to be known. That's why it's so important. Also, in context of the COVID-19, as all of you are aware, that our region has been terribly hit based on the presentation also that were presented. So there's a really need to work together to share the information. So you will help the African CDC to provide the technical support to member states in all areas that are in line with the strategic objective of the Africa CDC, from surveillance to contact tracings, also gathering the information for modeling, for diagnosis, for clinical care treatment, for logistic support, and others. Also, Africa CDC, like Isn't put it, we have a very strategy, some of information that will be relevant and the member state would like to know, and some of the strategic guidance in terms of the COVID-19 vaccines. So it's good that it's been put on the agenda for the next weeks. So there will be some technical guidance specific what countries need to be do to learning from the experience of other countries in Europe and America and others. So we don't have to go through the same thing that they have done wrong. So we have to use those information and put them into the context. But also I need to encourage you that especially the countries that share with the Southern Africa RCC ECO platform, AOC platform information, especially Zambia, Malawi, Zimbabwe, and Lesotho. So we need to thank all of you for trusting and also for helping the Africa CDC to have access to timely information. And we need to assure you those information are used for that purpose to help Africa CDC and in particular RCC to understand what are the health issues, what are the gaps, what are the needs, so we can be able to provide those technical support and very timely. Because if we don't know, we can assume that this is what is going on. And also we need to thank all the countries that has shared with RCC their needs after the last ECO in terms of what are the needs in terms of the COVID-19. We truly also appreciate, we share those information with HQ, and action is being taken in terms of some of those supplies and some of the rapid responders on behalf. So we need to encourage you that we need to make this forum as interesting and also for the information sharing for that purpose. So we need also for those countries that are not yet responded. So we're also working with our HQ to write note barbels at that high level to Minister of Foreign Affairs, copy to the Minister of Health to encourage them to also to appoint a substantial focal point that will be in direct contact with the RCCs in the regions. So in the meantime, we need to encourage so some of you who already established a contact with RCC to continuously supporting the RCC and continuously also encouraging your colleague in the member state to do the needful by sharing those information and also by sharing the gaps and the needed response in all health emergencies. So with this, I would like to thank all of you for the work that you are doing and for your commitment and compassion to provide the health services to the people of your own countries. So we are here to support and to complement the work that you do for the safety and well-being of your people. So we are on the same page. As many of you are aware that African CDC or African is a technical agency of the African Union that was made by the head of the state. Any member state in this call, they are represented. So we are part of you, just to see how we can be able to help those ones. So any information we collect, we use it on that purpose only, for the support and guided also by the mandate of the Africa CDC. So we encourage you that to extend our invitation to all your colleagues, especially those who are in vaccine. That next ECO session is going to be very, very interesting, updating and providing some of the up-to-date information when it comes to vaccines. So with this, I want to thank all of you for joining in. I want to thank all colleagues from RCC for facilitating and for coordinating this. So with this, thanks you and have a good afternoon. Over to you.
Thank you very much, Dr. Lu, and have a good afternoon, everyone. See you in 2 weeks' time. Stay safe.
Thank you.
Thank you very much.
Thank you. Bye-bye.
Thank you.
Thank you. Bye.
Thank you. Bye.